It is my great pleasure to be with Professor Fatima Husain from University of Illinois, United States. And Professor Husain is going to take part in the 6th International Conference of Hyperacusis and Misophonia in London on 1st and 2nd of July. So Professor, tell us a little bit about your research that you like to present in London.
Well, first of all, I'm very excited to participate in the conference. This is the first time I'll be participating in such a conference, and the first time that I'll be presenting our findings on misophonia. So I have previously not worked on misophonia. I have about, I think, 16, 17 years of research on other hearing disorders like hearing loss and tinnitus. In the past 6-7 years, we have started focusing on hyperacusis, which is another sound sensitivity. And when this opportunity came through from the Misophonia Research Foundation, we applied for a grant. We were successful. And so we started collecting data about, well, we were successful right in the midst of the pandemic, which made data collection somewhat delayed. This is an elaborate project where we have multiple pieces to it. The initial piece is this online survey, which you can do during the pandemic. And we focused on a very somewhat narrow population. We focused on collegiate age population. So these were students between the ages of 18 and 25 in my university here in the United States. And we sent out the survey to about 12,000 students. Of whom about 1,200 to 1,300 actually completed the entirety of the survey. So it is a very large database in that sense that we can now go in and investigate different aspects of misophonia, aspects of its association with hyperacusis, its association with tinnitus and hearing loss. Right? So we asked them a lot of questions, and we also asked them about their psychological health as well. So we have a very comprehensive kind of survey that we did. From there, we have now selected individuals to come in for an in-lab study. So the big thing about was doing this survey was we do not have a pre-existing clinic where we are treating individuals with misophonia. So how do we recruit them? How do we have them come in for an audiological study, a psychological evaluation, as well as a 1-hour brain imaging study? So it serves both purposes. And the other reason to think about why we focused on this 18 to 25-year-old cohort was because of when misophonia is supposed to begin. So the onset is typically between 12 to 14 years. And if we wanted to see changes that have sort of settled down, if we have persistent misophonia rather than episodic kind of thing, it happens because of some issue, then it goes away. But if this is persistent misophonia, it has had several years to settle down, several years for the brains to show any changes, then we want to grab them at this point, especially if we are going to look at any anatomical changes in the brain. So it seemed an ideal kind of population to focus on. So our goal with this is a baseline study. We are going off other studies, about 3 other population-based studies that have been published on the collegiate population around the world. And ours would be probably the 4th study to our knowledge, right? So this is not a large area, but we are leveraging what has gone before, and we want to set ourselves up for more successful, detailed investigations going forward.
How fascinating, because you are right. There have been several studies, maybe 3 or so, on students in the college and universities, and but there is quite a discrepancy between the results. So it is great to see yours, which are larger data set, and it is great that you are looking at lots of different factors and misophonia, so to be able to see what is related to what, if you like.
Exactly. And again, we acknowledge that this is subjective. We acknowledge that this is self-report. But again, we have brought in already about 100 participants for in-lab studies. So we have this link between subjective self-report and more detailed measures. Some of them are objective within the lab that we are conducting, right? So that will also, I think, be this is a step forward for misophonia research, that we are linking these very subjective measures with detailed in-person study.
Exactly, and that is very good, because a lot of the studies on misophonia have been led by specialists in fields other than audiology. They've done great work in terms of understanding this: psychiatrists, neurologists, neuroscientists. A lot of imaging studies were led by those kind of disciplines, and which is fantastic. We didn't have this with tinnitus as much as we have with misophonia. I think that's why it's kind of making misophonia a bit going faster, if you like. The progress is quite fast.
Yeah. There is much to be yet to be sort of established about misophonia, though, right? So one of the things is about having validated questionnaires. We sort of got them late in the game, right? So in that sense, it is harder, though, to diagnose misophonia than it is to diagnose someone with tinnitus. To diagnose someone with tinnitus is just one question: do you have this constant ringing in your head? Yeah, right. And they'll say yes or no, and we've established that someone has tinnitus. But to establish that someone has misophonia, I think, is it's a complex set of questions and good metrics to get to it. And I think the field is evolving to understanding and establishing what those metrics are in order to be able to diagnose that someone has misophonia. And I agree completely with your point about audiology, for instance, or hearing sciences actually have not paid as much attention to misophonia as other disciplines have, right? Even though it is a sound sensitivity at its heart, right? Yes, we have this very elaborate psychological reaction, which is its hallmark, but at its heart, it is sound sensitivity. And so we want to have this sort of inter-scientific, interdisciplinary, interprofessional outlook on misophonia without forgetting all these other contributions. So one of the things we wanted to, I guess, throughout this project is to establish how the underpinnings of the sound sensitivity and differentiate it from other hearing related disorders, especially hyperacusis.
Exactly. And that is basically one of the main aims of the conference, bringing together scientists from different disciplines. We have audiologists, hearing scientists, psychiatrists, psychologists, occupational therapists presenting in the conference. And, so to be that sort of, because from each angle that you look at this problem, when psychiatrists look at misophonia, they see signs of certain personality disorders or different anxiety disorders, and because this is what they're very well equipped at. When audiologists look at this, then they can see signs of hyperacusis and how this can be distinguished from a noise sensitivity issue as opposed to a particular misophonia. So I think there is a huge amount of things that discussions and debates in a conference like the one that we'll have in London can actually be useful.
Yeah, and I think that there is a great overlap sometimes between them, right? So it is not unusual to find someone who has both misophonia and hyperacusis, and who may also have anxiety disorders, right? But others with misophonia need not have those other overlapping conditions, right? So some of the mapping needs to account for it. And if we also probably as a field need to think about severity of misophonia, right? Not rather than that it's a binary question, right? The same way we've accounted for severity of tinnitus symptoms for the longest time, rather than going beyond just the binary question if someone has tinnitus or not. So, so I'm hopeful to come to the conference and to learn about the state of the art in misophonia research.
Fantastic. I look forward myself to listen to your presentation and learn from the things that you have achieved and your result. And I'm sure there will be lots of discussions that we can have to basically shed some light on hyperacusis and misophonia. And thank you very much.
You're welcome.